Everyone talks about patient safety in the NHS, but very few people can actually explain the patient safety strategy in a way that makes sense in real clinical practice. So in this video, I will break it down into the 3 simple pillars with real examples you'll recognize from your day-to-day work. If you're new here, I create content on clinical governance, patient safety, and nursing careers beyond the bedside. Let's simplify this. The NHS Patient Safety Strategy is built on 3 core pillars: insights, involvement, improvement. If you understand these 3, you understand the strategy. 1. Insight. Insight is about understanding where and why things go wrong. This isn't just incident reporting, it's about understanding the data and using the trends and learning to see the bigger picture. Take, for example, a ward where there are repeated medication errors during night shift. Under insight, you wouldn't just log each incident separately and leave it at that. You would ask, is there a staffing issue? Are interruptions during rounds affecting it? Is there a training gap? It's about moving from an error happened to why does this keep happening? This is where PSIRF, incident data, complaints, and even staff feedback all come together. 2. Involvement. Involvement means bringing people into the safety conversation, especially staff and patients. Patient safety is not something done to people, it's done with them. Another example, a patient experienced a delay in diagnosis. Instead of reviewing the notes internally, involvement means speaking directly with the patient and family, understanding their perspective, including them in the learning response. It also means listening to staff. For example, a junior nurse raises a concern about unsafe discharge process but feels ignored. That's a failure of involvement. A strong safety culture ensures staff feel heard, patients are included, and concerns leads to action. 3. Improvement. Improvement is where learning turns into action. Without this step, insight and involvement are pointless. Let's go back to the medication errors at night. Improvement might look like adjusting staffing levels, introducing protected drug rounds, redesigning medication chart, providing training, and most importantly, measuring whether these changes actually work. Because improvement isn't just about doing something, it's about making sure that care is safe. Bringing it all together now nicely, here is the simplest way to remember it. Insight means understand the problem, involvement means including the right people, and improvement means making meaningful change. You miss one of these and patient safety breaks down. If you work in healthcare, you're already part of this strategy, whether you realize it or not. The key is being intentional about how you contribute to safer care. If this helps simplify things, follow for more content on clinical governance, patient safety, and NHS systems. I would like to hear from you. Which of these 3 pillars do you think your organization struggles with the most? Keep listening to Dash In Depth Nursing.